Welcome to Spotlight on Chronic Kidney Disease here on Hospital Radio for Bristol, where this time we look at healthcare sciences. Academic and chartered scientist Shahid Mohammed firstly explains what chronic kidney disease is.
Chronic kidney disease can be defined as a long-term irreversible health condition which relates to where the kidneys are affected and there is a problem around kidney function over weeks, months or years. So the word chronic meaning over time. Individuals can have problems around their kidneys for a number of reasons. Ultimately, individuals have problems avoiding urine to get rid of toxins from the blood, as the kidneys have that as one of the main functions.
What are the main issues surrounding educational support for kidney patients?
In the public domain, there's been a heavy focus around other health conditions, things like blood pressure, diabetes, respiratory illnesses, cardiovascular disease, and so on and so forth. And these conditions, although they are very important, chronic kidney disease doesn't really get a mention in comparison. The literature and the educational support in the public domain around chronic kidney disease isn't as sufficient as it should be.
So what mechanisms of educational support exist?
There are kidney care charities and organizations that do provide informational support. One of them is known as the Renal Patient Support Group, or the RPSG. That's been going on for the past decade, highlighting different areas of chronic kidney disease and acute kidney injury, actually. There are other mechanisms where healthcare professionals in primary care do look to signpost patients who might be suspect or high risk for chronic kidney disease.
Why is education support around the science of chronic kidney disease important?
It's very important because chronic kidney disease is one of those healthcare concerns which heavily relates to test and investigation requests from different health professionals between healthcare sectors. For example, midstream urine, which used to be one of the traditional things to detect renal abnormalities, but also things like having what's referred to as a creatinine clearance test, which is the main biomarker to an understanding of renal function, amongst others.
What's the real issue surrounding kidney care and research?
People need to know more about it because of the other health conditions that are going on in the public domain, and in particular, I guess, because of issues around COVID-19 and how that is prompting everyone to be a bit more vigilant about aspects around their healthcare. And that also means that researchers and academics and even clinicians and different health professionals are also having to ensure that there should be more evidence-based literature out there so that the public can get a good understanding around this particular healthcare concern.
What initiatives are out there to support patient care and healthcare researchers?
The Renal Patient Support Group in particular has initiated various numbers of audios and podcasts to help people along their journey around different aspects relating to their kidney disease. But there are other initiatives. There's actually one initiative that's been working alongside the Renal Patient Support Group, delivering audios and podcasts relating to healthcare sciences. That's one of my own initiatives, actually. There are others, for example, Kidney Care Research UK, there's Kidney Care UK, there's the National Kidney Federation out there, and all of these organizations are doing what they can to highlight areas around involvement and research, and hopefully through those mechanisms, people could get a good understanding of some of the most important topics to get to know about.
Spotlight on kidney care here on Hospital Radio for Bristol with academic and chartered scientist Shah.